So as Katie mentioned, my name is Alex Dolson and I'm the agency coordinator with the Kamloops Sexual Assault Counseling Center. And KSAC is a nonprofit organization located here in Kamloops. We do work also in Chase and Logan Lake and Ashcroft, some of our smaller surrounding communities. And we provide free, non-judgmental, confidential services to survivors of sexual violence. And so that looks like counseling. We do group and one-to-one counseling. Victim support workers are able to support folks navigating the justice system, crisis response, so hospital accompaniment and our crisis line, as well as working to do community outreach and education, which is part of why we wanted to do this. We wanted to provide this information to our community so that everyone feels equipped to respond to sexual violence. Before we get into the meat of today, I want to acknowledge that we are on the unceded territory of the Kamloops Secwepemc people in Secwepemc Ulu. And it's important to acknowledge this always, but especially when we're talking about sexual violence. We know that colonialism and sexual violence go hand in hand, and that Indigenous women and girls and Two-Spirit folks are disproportionately impacted by sexual violence. And so we have to acknowledge this relationship and the incredible harm that it has done to this territory and to its traditional caretakers. When we're working to address that colonial legacy, we have to acknowledge this harm. And I know there might be folks joining today from outside of Secwepemc Ulu. And so I invite you to take a moment to recall and express gratitude for the territory in which you're joining from. And if you want to, feel free to pop that territory name into the chat so we can all honor the different and diverse territories that we're joining from today. I also want to make sure that I provide a bit of a content warning for today's conversation. So sexual assault is a deeply personal and prevalent issue. And I encourage all of you to take care of yourselves as you're listening along. If you feel yourself becoming triggered or overwhelmed, please do what you need to in order to stay safe and well. So if you need to leave the call, that's perfectly okay. If you want to try some grounding, sometimes deep breathing is helpful. You can inhale for 5, hold for 5, and then exhale for 5. If you need some additional supports, we do have our crisis line open and available, and I'll pop that number in the chat afterwards. And that is available 24/7. So whether it's during this panel, later today, tomorrow, or anytime in the future, we have folks standing by ready to support you there. And there's no shame in having a response to this conversation. You should feel impacted by this conversation. And those feelings are so normal and incredibly common. We know that around 1 in 3 women and 1 in 6 men will experience sexual violence in their lifetime. And those numbers are even higher for marginalized people. So people that are part of the queer community or racialized, folks living with disabilities. Whether you know it or not, someone that you love has been sexually assaulted. And that prevalence is part of why we wanted to do this conversation together. Regardless of who you are or the work that you do, chances are at some point, someone will disclose to you that they've been assaulted. And the response a survivor receives after disclosure, whether that response is positive or negative, it has a significant impact on the survivor's path towards healing. So it's important that not just service providers, people working in this field, but the wider community knows how to support a survivor. Whether it's your friend or your coworker, your family member, the information you hear today will help prepare you to support those people that you love. It takes such bravery and strength and resilience and vulnerability to be able to share your story of sexual assault. And we want to make sure that we can honor that bravery by responding with compassion and with accurate information. So what do I mean when I say sexual assault? There's a lot of different terms and they get used interchangeably. So sexualized violence, rape, abuse. KSAC supports survivors of all sorts of sexualized violence. And we see sexualized violence as any non-consensual, whether that's actual or threatened, behavior that's carried out through sexual means or by targeting a person's sex, sexual identity, gender identity, or expression. So intimate partner violence, sexual harassment, those are both forms of sexualized violence. But today specifically, we're talking about sexual assault. And in Canada, our criminal code uses the term sexual assault to describe any unwanted sexual contact. The charges are based not on a specific act, but on the level of violence or force. So it considers factors like if there was a weapon used or the injuries sustained. And the code doesn't base charges on the perceived severity of a particular sexual act. And that's really important because it recognizes that the trauma of sexual assault isn't some hierarchy, with some sexual acts creating more trauma than others. If someone commits a sexual act to you or upon you, and they do not have your consent, that's sexual assault. Whether it's penetrative sex or any other sort of sexual act, that is sexual assault. So please know that today when we talk about sexual assault, we're talking about a broad range of experiences and circumstances, all of which are valid. Another note I want to make is around some of the gendered language that you might hear when we're chatting today. We know that folks of all genders experience sexual assault. It's not just women, but we do also know that around 97% of survivors of sexual assault identify as women, and 97% of reported perpetrators are male. And that's information that we have from Stats Canada. So many of the responses and the research on this subject are geared towards that reality. That's not to exclude the experiences of men or other genders, because we know that those assaults do happen. But the nature of this work is that most of the time, we are responding to disclosures from women about crimes perpetrated by men. But sexual assault is not just a women's issue. It's a societal issue that harms everyone. And as such, we need folks of all genders helping to respond. So thank you to everyone for tuning in today and helping to be a part of that community response. It's my pleasure to formally introduce to you today our facilitator, Katie Newstater, who'll be guiding us through this conversation. And Katie is the Executive Director at the United Way TNC and an individual who cares deeply about the lives and experiences of individuals. Katie is passionate about honest, meaningful dialogue that informs and includes people of all walks of life for the purpose of creating a more compassionate and connected community. Through her work at the United Way, Katie seeks to improve the lives of people through funding of programs that serve vulnerable populations and ensures supports are available for those in need. CASAC is one of those organizations to receive funding, and we're so grateful to both the United Way and their donors for this support. As Katie mentioned, we do share friendship, and I've seen firsthand just how deeply Katie cares for our community, and I feel really lucky to call her friend, and this community is really lucky to have her. And so Katie, I'll hand it over to you.
Thanks, Alex. Well, now that Alex and I are done singing each other's praises, maybe we can move into the meatier part of this conversation, which is great. But I find I learned something. Like I've already walked away learning something, even from just that information that Alex presented, and that it was really important to build a bit of a framework around that, to even just put some definition around sexual assault, right? We hear these terms, and I think we can best learn what they actually mean and what we're talking about from the experts who work in this field. So I hope that gives us a little bit of a groundwork to come from. But I also think it's important when we have these kind of dialogues to recognize this is imperfect learning, and that experts in these fields hold the language that is necessary and understand what that looks like to interact sensitively as we talk about these things. But there are those of us who just need to learn from the ground up, and that we might have one experience in supporting somebody, but we want to grow our knowledge and our sensitivity around it. So this is about imperfect learning, and that we might tread on words that are not okay in this circle and are not as sensitive as they could be, but we are here to learn, and we can't be afraid to have these dialogues because we don't know exactly how to express these things in proper language. This is about people who want to come alongside in very unpredictable situations and to be able to support someone. So I think we're going to set aside the obligation to be perfect in these moments and instead just to be learners. It wasn't very long ago that we didn't really talk about sexual assault. I had a conversation with my grandma not long ago where she just said, you know, in my day and age, it was very understood that you do not talk about it, let alone put it on a public platform and say, join us to talk about this, join us to learn. It was, you do not talk about that to anyone. This is something that you set aside and you deal with privately. And I am so encouraged to see that people show up bravely and in brave spaces to begin changing that culture or continue changing that culture so that we can have these dialogues. So without further ado, I'd like to introduce our panel of experts who are going to be bravely fielding questions in a recorded environment. I think it's important to acknowledge that that is brave to come forward with your expertise and talk about this. So a huge thanks before we even get into it to these panelists. I just ask that you give a little wave when I say your name so people know who you're attached to, although your name is on the screen there. But we'll begin with Corey Tucker, who has been a volunteer on the Domestic Violence and Sexual Assault Response Team for 3 years now. By day, she works in the male-dominated industry of IT, and in the evening, she works as an instructor in risque performance arts. She brings a strong sense of advocacy for more balanced representation of all genders across all systems, and feels strongly about sexual health, sex worker rights, and bodily autonomy for marginalized genders. Thank you for joining us, Corey.
Thank you.
Tracy Scott is the clinical nurse specialist for child maltreatment and sexual violence for Interior Health, and is responsible for helping to develop and implement best practices in sexual assault care across lifespan. What a great bio. Tracy has been employed by Interior Health for the past 31 years and has worked in a variety of settings, but her passion has been focused on advocating for those impacted by child maltreatment and sexual violence at a local, regional, and provincial level. Thanks for joining us, Tracy. Jen Johnson has been a volunteer with CASAC since 2018 and was honored to join the staff in 2020. In collaboration with Kamloops Immigrant Services and TRU, she works to remove barriers and increase access to support for newcomers to Canada who are experiencing gender-based violence. Jen approaches her work from a justice-seeking, trauma-informed, and intersectional feminist lens. Thanks for joining us, Jen. Megan Haggerty is a sexualized violence prevention and response manager at TRU, providing education and support for the campus community. She has a background in health equity and is working towards a PhD in community engagement, social change, and equity, which just sounds fascinating. I feel like we could camp out there for a whole day and just learn about what she's learning about. Megan enjoys spending time outdoors, appreciating the beauty of landscape around her, and is excited to learn from and contribute to today's discussion. Welcome, Megan. Constable Rachel, I took a practice run at this, but I still might mess it up. Constable Rachel Bozak, is that close? Okay. Works as a sex crimes investigator with the Kamloops RCMP. Rachel hopes to help survivors navigate through the process of reporting offenses to police while offering the highest level of investigation possible. Thank you for your contributions and for offering us your expertise. So we're going to move straight into our panel here. And as you can see, this is a fantastically qualified panel who has interacted with a lot of different circumstances and heard a lot of different stories and has a lot to offer us. So we're excited to get into it. Some of these questions are specifically geared for one of you. We've kind of attached a name that kind of made sense to the questions, but I hope that we can have a real contribution from everyone as we go. So, and that includes Alex. I think it's important that we make space for her expertise as well. So we'd also just invite Alex to jump in as something makes sense or we see gaps in questions and to contribute where you want. Alex, feel free. So this first one is just for everyone, and this was my own curiosity. You know, as you read those titles and understand the work that you do, this is obviously important, but also very heavy work. And when I think about what that means across the span of a lifetime to commit your life's work to this, it just made me wonder, why do you do this work? It's a personal burden that you are taking on and you carry these things with you. I wondered if you'd each take just a minute to talk about why you feel called to this work and why it's what you choose to practice. Maybe I'll just call, just so that it's simplified in this Brady Bunch world that we live in, I'll just work through the screen as I see it. So Jen, I'll put that question to you first. Why do you choose to do this work?
For me, it's a lot to do with kind of what you were talking about, like that conversation with your grandma, where a couple of generations ago, this was just something that we wouldn't even conceive of having a conversation about in this kind of a public way. And that we've gotten to this point because of the work that's already been done, like 30, 40, 50 years ago. It was so much different. Like our laws were completely different and the culture was completely different around talking about these things. So being able to step in and kind of build upon the work that's already been done to then hopefully like leave things even that much better for generations coming after is, I find it really inspiring and hopeful. And also like those stats that Alex were mentioning, you know, gender-based violence and sexual assault is still an endemic problem. And the only thing that I can conceive of being worse than that happening is that that's happening and there's no one there to support those people afterwards.
Well said. Well said. Corey, turn that over to you.
Sure. Thanks, Katie. For me, working as a response team volunteer, I do that primarily because I can't imagine anybody needing to go through that by themselves. So without information and without support, that's why I do it.
Yeah, compassion, a compassionate response to your need, absolutely. Constable, what should I call you, Rachel? Can I call you Rachel?
Just Rachel is fine. I know a lot of
people with Rachel today. Okay, Rachel.
So on a personal level, I've always had like interest in like bigger investigations that require like a little bit more in-depth, like keeping up with new case laws and whatnot. So going into more like investigation heavy files has always been more of an interest to me. And then specifically when it comes to where there's like victims, especially victims of such a personal and serious nature, like on a personal level, one of my best friends, like before I was even a police officer, was a victim. And I saw that the police officers that helped her through this really made a big difference. It was really bad. She eventually had to like move out of the country for her own safety. And these cops would like wake up in the middle of the night to be able to call her based on time differences and things that I saw that these cops did to really help her. And I see now, like a decade later, how she's been able to, you know, move on with her life and has a family and kids and is, you know, a functioning member of society. Is if I can be that for one person, then that's kind of my goal.
Incredible to hear that come out of a positive experience. Because if I'm being honest, I expected you to say, you know, and she had terrible treatment or her experience was negative or exacerbated what the original, you know, the original assault and problem. But it's lovely to hear. I was inspired by a positive, effective response for a friend. That's great. Megan.
Yeah, for me, I think a lot of those things resonate as well, kind of that leveraging my own privilege to be part of the solution and support people. And it never fails to amaze me, the resilience and creativity of survivors as well, and how there's kind of a parallel, not to say that it's not devastating and can't be, because absolutely. At the same time, there's these parallel threads of resilience and resistance and creativity for getting their needs met. Yeah, that's what I said. So yeah, I really enjoy being like privileged enough to be a part of that with people.
Yeah, absolutely. And Tracy.
Hi. So yeah, I sort of naively came into the work 18 years ago when I first started at our regional scan clinic, so our suspected child abuse and neglect clinic, where I was a nurse clinician for 12 years and saw all cases of child abuse, which included sexual violence. And within that, we had an incredible partnership with Child Protective and RCMP, and then our healthcare team there who all became much experts in all this area. But I always felt there were some gaps that we could do just a bit better and so on and so forth. I know even like I'll be part of all those exams with those kids, people did ask me all the time, like, how do you do that work? And I sort of said, how dare I not? These kids have been impacted. That's not something I can prevent. However, I have an opportunity to switch the pendulum and be part of, like you say, the solution. And that helped me sleep at night and continued on. So I just continue my education on and to get into a leadership role with the whole region. Yeah, and I just want to send a shout out for Constable Rachel Wozniak, because she's just absolute blessing. We've been without a sex crimes position for a while in our community. And as you've seen, she's incredible, and she works very collaboratively with our SCAN clinic and our Big Bear Child Youth Advocacy Center, and then her and I in the Merge Department in Kamloops. So yeah.
Wonderful. And that's exactly what we want to see, an informed network that supports people with, wraparound services from beginning to end, and supports them without gaps through these services. So that's wonderful to see the community work already being connected. And Tracy, really well said, how dare I not? And I think that's probably why most people have joined this call today, because we feel like, we personally cannot always prevent these things from happening, but how dare I not stand with somebody in their moment of response and need? So I think, yeah, that's a great way to frame while we're continuing this conversation. And I think a good place to start is, how can we let people know that we are a safe person to talk to about sexual assault? I think maybe just a couple of you who have an answer for that, feel free to stick up your hands or just jump in, but maybe 3 of you can answer that. How, as a community, do we let people know that we are a safe person to come to? Megan, maybe this is a good one for you to start with. Working on campus, I think maybe that's a good place to begin. How would a student know who they can and can't talk to?
Yeah, I think lots of great answers for this. One that always comes to my mind and that I try to talk to people about is, it's little things, right? So it can be things like not joking about rape, not laughing at a joke about rape or sexual assault that you hear. That can be an indicator to people that you are a safe person to talk to, or saying something when you hear jokes like that, or when you see it in social media, even being like, oh, that's actually not super cool that happened, or in pop culture. So I think starting from that base can start to indicate to survivors that you might be somebody they can connect with and get a good response from, and a non-judgmental response from.
Excellent. Anyone else want to jump in there? How do we kind of tell the people around us, the workplace, safe person to invest that information in?
If I could add something to that. So I find like a lot of times there's an obvious hesitation with like interaction with police and fear and uncertainty. So I will gladly take as much time as necessary to like walk people through a process or explain what that might look like, to like reassure a person before they come forward, so that they can make the best decisions for themselves, right? And that's something that I'm really working excuse me, not just myself, but with the entire detachment, all the watches, all the different levels of service and expertise that I work alongside. So really trying to get that out there. And although the position is still new, that's kind of my goal long-term, to really help people in the community know that we are a safe place and everything is investigated thoroughly. There's oversight and all that stuff.
Excellent. Tracy, I think I'm curious about this from your perspective too, especially when it comes to minors, right? Because we're talking about a really specific demographic, and one that can be hard, maybe doesn't even have the language, or in a, I think of teenagers, I have teenagers, it's a very vulnerable time just for normal disclosure of information, let alone something traumatic and complex and so deeply personal. What does it look like to send that messaging out to young people to say, I'm a safe place?
Yeah, that's a really great question. Like, again, because we're sort of dealing with the children and youth once they've been referred to us. But my best thoughts is to really start in the school systems and creating that safe space to even disclose to a teacher, or it's okay to talk about things, and sort of really promote that culture of normality, I guess, around that, and a safe environment. So I think schools, certainly at the universities, and I've worked with the universities on their policies, sexual assault, and again, just doing a great job. I see all the your bathroom, well, most places now in their bathroom, they have those posters of who they can call, and I think it's really the community coming together to develop what we think, and from our survivors that have been through that, what is the best way to create that safe space, and how do we sort of, if you will, market that? It's still something I feel work on.
Yeah, that's a really good point. Educating the community at large about the safe resource to go to be able to disclose, right? And I think that's really powerful work that KSAC is doing too, getting into schools to say, here are your safe places to land. And also, here's what's not okay. Because I think the question also becomes, is this valid enough for me to disclose it to someone? Is this something I should just tuck away and deal with on my own, or is this information I should invest somewhere safe? So yeah, that's a great point too. If someone tells us that they have been assaulted, what's the first thing we should say to them? I think that that's very intimidating for people to think of, you know, somebody disclosing to them, and how do I respond right from the get-go? Corey, maybe I'll put that one to you to start with. What do you think an initial response should look like from somebody who's looking to come alongside of somebody who is a survivor?
I think when we're first initially responding to somebody who's brought up that they've been assaulted, it's very important to believe them. So to say, I believe you. It's also very important to make sure that you're not downplaying it. So, oh, you'll be fine kind of thing. So just making sure that they understand that it's important to you, that you believe them, that you will be there for them. I think that's probably the most important thing, is just to provide support and an ear and information if you have it, just to make sure that they feel supported and that they understand the severity of what happened to them.
Yeah, I think if there's only one thing to take away from that, it's that starting point of I believe you. Right? I believe you is a powerful statement. And Jen, maybe I'll move that over to you. Do you have anything to add to that kind of initial response? You know, if you're to say someone, if there's nothing else you remember about that first moment and how to respond, what would it be?
Yeah, I really echo what Corey said. And I think too, like it can feel a little bit awkward to actually say like, I believe you. Like if that's sort of like the first thing you say, you know, it's almost a bit like, okay, like
why wouldn't you believe me?
well, yeah. But I think that I think that is such an important message to get along. And sometimes just actually verbalizing that is the thing to do. But also there are ways to do that with your body language and with the way that you're interacting, like being fully present with that person while they're speaking. And thanking them too for the courage to come forward, because we know how many barriers people face, like whether it's kind of that internalized stigma or just different messaging, feeling like it wasn't bad enough to want to bring it up. I think all of those things are so important to keep in mind. Like you might be feeling really overwhelmed by the fact that this person is telling you this, but just remember that they're probably also really overwhelmed and feeling quite, you know, all kinds of different things bringing it forward. So just be okay with maybe being a little bit uncomfortable and just try to stay as calm as possible and be, like Corey said, kind of that listening ear and just showing them that you're there with them in that moment. And, you know, you can be a little bit awkward and uncomfortable together. And I think that can go a long way rather than trying to, you know, have the perfect answer. Just really trying to be there with them.
Yeah, and I think we have lots of questions, so we want to keep moving, but I don't mind camping here just for a couple of seconds, just because I think that this initial response is, you know, a primary need to know for those who want to come alongside a survivor. So Alex, I wonder if you'd also add a little bit for me here, just to expand a tiny bit more. I also wonder about, you know, the physical response when you talk about body language, Jen, what that means too. I mean, there's so many scenarios in which your initial response to the pain of another human is to give a hug or to come alongside in a physical way. Well, we're talking about something that has really specific impact on that body language and that physical response. What would kind of your advice be there, Alex, as you interact with somebody who is coming to you with this information?
I think the best thing you can do is just take the survivor's lead. Obviously, there's going to be differences depending on who's disclosing to you. You know, if you're in a professional context, or you know, a teacher's response is going to look different than a parent's response. But most importantly, to create an environment of consent and give that autonomy back to the survivor. So they've just had an experience where the control over their body was taken away from them. So asking for permission for things that might seem silly, like, is it okay if I sit down next to you here? Asking them and giving them the ability to be in charge of that situation and make those decisions for their body and for their own care and wellness. It can be pretty powerful to be returning that to them. So yeah, just take their lead and ask for permission.
That's great. Yeah, and I also think it probably depends, context is always king. But what does that look like for somebody who's disclosing 25 years later, right? That's something this will bring up as opposed to a recent event. And yeah, I think of somebody who just talked very generously at a different panel I had, but she was talking about disclosing a sexual assault from her childhood to her husband for the first time after 30 years of marriage, and how different that response looks, and that we need to kind of readjust our thinking too, and that every response to a sexual assault is different, and the lead time that it takes and that cultural shift is different, right? This is a woman in her 60s. And when that happened to her, it was culturally faux pas to talk about it, but that these conversations are always helpful, that it might take 40 years before somebody's ready, but to stand with them in that way, however long it took. Tracy, moving over to you, what can a patient expect when they go to RAH after being assaulted? What does it look like on that initial entry to come to the hospital, which I imagine is a terrifying moment, not really knowing what you'll find on the other side of those doors?
Yeah, no, absolutely. That is, so as you know, survivors can come to the hospital by different means. So they sometimes RCMP are bringing them in, sometimes ambulance is bringing them in, sometimes it's a friend, family, child protection, and certainly KSAC. What I really want to support and encourage is the fact, and sort of give kudos to, is the fact that KSAC has worked with myself for quite a few years now in developing a crisis response team with their volunteers, normally called SARTs. My head's still trying to get around the name shift, but how we've sort of prepared volunteers is, if they show up at KSAC to disclose, and what I really come to know is often patients survivors don't come to the hospital. They will go to KSAC or somewhere else, and they actually won't because of all the things. At least KSAC volunteers now know, and we've taught them sort of what they can say, they can expect, and what their options would be. So I think that sort of preliminary sets these survivors up for success if they're going to come that way. But if they don't come in that way, basically they'll come into the hospital, they'll get triaged just like every other person would be to rule out the medical concerns, et cetera, et cetera. At triage now with KSAC, we have this response group. So our triage nurses are to ask the survivor if they'd like an accompaniment of one of the volunteers. Sometimes they say no because they've got a friend or somebody else. But it's a lovely option that somebody they don't know, not personally related, to come and sit with them at the hospital. So that gets set off right at triage. And so while we're waiting for the volunteer to come up, also the physician will be called. We've got 4 physician sexual assault examiners at the hospital right now, and one of them will be called in to do the exam. And at that time, that's when we would help the survivors understand what their options are. So currently, right now, the only 2 options are to consent to just medical care, so injuries and or prophylactics or pregnancy prevention. The second consent is medical plus reporting to police that day, so having your evidence collected and handed over and reporting to RCMP at that time. And a third that I keep saying, but we really are so very close, is the best option, in my opinion, and from a trauma lens approach, is to be able to offer the survivor the option of, and recognizing they may be in trauma, they may not feel safe right now, to say, you know what, you may need some time to sort of think about how you want to respond and whether you do want to report. Therefore, we can today provide you all the medical care, we can collect all the forensic evidence, and we can store it on site here at Royal Inland. In the event up to 1 year you do, when you're well and wanting, if you want to go forward, then we at least preserve their evidence for their file for RCMP. So I think it's working hard that way.
And I imagine that's part of that giving power back piece that Alex talked about too, right? The ability to stop and pause and process a little bit, and even to take that time to to think about, do I have a support system that I'm comfortable bringing in to make this decision with me, is a really powerful thing. Yeah, and that sexual assault response team, what an incredible thing to have. I talked to a young woman not long ago who said, when I was sexually assaulted, my parents were both immigrants. They had a totally different mindset. I could not talk to them. I was afraid of what my friends would say, how they would judge me, and a stranger showing up for me in that moment is the best thing that could have happened. That's what I needed. Someone disconnected from my everyday life while I processed what had happened. So, Corey, could you talk just a tiny bit about what that looks like to stand, in that place for someone during that moment, what it's like to come alongside of someone who was a stranger to you a moment before, and now you're with them in this kind of a moment?
Yeah, it's obviously really hard, right?
Mhm.
But very important. So I've been on a few hospital responses, and in all of those cases, it was you could tell that it was very needed. A lot of the time, the folks who come in, they've just had a traumatic experience, so they don't always they're not always in the best place to retain information, to be able to share information, to be able to understand and make decisions about where they're at or where they want to be. So it's such an important service.
Yeah. And I think that very thing, somebody who can advocate a little or engage memory, right? To be able to feed that information back later on. Yeah, an incredible role to serve. Rachel, moving back to you, what's the process then for reporting to police? And not only what can a survivor expect, but what can a support person expect? And even more than that, what should they expect? Because, I think a lot of us have heard those negative stories that say, I went to police and this is what I experienced. So I don't necessarily advise that people go and report. That's what we want to change, to make it a safe place and make it so. What should people expect so that they also know how to ask for what they need in that moment?
Yeah, so that's something like a big thing that I like to address as well. So obviously there's no like cookie cutter investigation, and it can be reported different ways. I'd say like mainly what I'd see is like a fresh offense that just occurred often comes through the hospital or whatnot, and then maybe a more historical. And historical doesn't need to be like that far back, but in a sense where maybe like forensic evidence is kind of gone at that point. So if this is a fresh investigation that like the offense just happened, things that the police, like our mandate is to investigate crime, right? So the first things we're thinking of are any evidence that could be lost. So whether that be like DNA, forensics, video canvassing, records on phones, things like that, things that can be lost, is to get that right away, as well as a statement. And a statement from the victim will help us do a risk assessment, determine our next course of investigational avenues, as well as what kind of support we can best reference that person to. And the reason for that is that where I feel like some feedback I've gotten or heard from survivors is that it's very front loaded. I gave my statement and then it kind of appears like maybe nothing really happens from the police standpoint. And that's where, from the police standpoint, having all these like support services, like community-based like volunteers, is super helpful, because in the background there's a ton of paperwork. There's higher and higher thresholds for obtaining warrants and things like that, and all that requires so much legwork and paperwork on the back end of things, where it kind of might look like nothing's really happening right now. So that's another bridge I'd like to try to gap, for lack of better words, where like survivors can always ask for an update. Hey, what's going on? but those are kind of typically the first two main things that would happen would be one, evidence gathering, and also getting a statement. And the reason we really want to get a statement right off the bat is also, as a few of you have said, the survivor can then, once that's given, they can take a step back and decide on how they would like to proceed. Obviously, like being a police officer, I always encourage people to report something, but that might not be the best course of action for that person in their life in that moment. They might not be ready to go forward with the justice system. They might not be ready to go forward with all of this. And that's totally fine. But if we have that evidence, and like especially the forensics piece, kind of like Tracy had mentioned, we hold that. And so if, a week, a month, 6 months down the road, that survivor has received all that support, then we're good to go. A file can be reopened and continue on, and there's no loss of evidence.
So I think kind of what we can expect is a lot of questions during an incredibly hard moment to answer those questions. But there is, as support people, I think that's important for us to know, to be able to, stand steady in that space during that time. And then some dead time, that there has to be an expectation around now at 6, and maybe reframing that as an opportunity to begin some healing, right? So then again, as people who are looking, how do I best support in this moment? It means then shifting away from that, allowing the police to do their work, and that stuff that needs to happen in the in between, and shifting to services that can help begin the process of moving forward, whatever that looks like for the individual. That's great. And then also more autonomy over the decision making. That's something that survivors should reasonably expect, that they have some control over how that moves forward. Megan, what about at TRU? What supports are available for students at TRU? I mean, I don't know how many of you who have joined us today have watched The Hunting Ground, or, documentaries like that talk about what this kind of violence looks like on campus, and maybe you have been enlightened just recently about how prevalent it was. That was a shock to me. Maybe I should have known, but I didn't realize how shocking those numbers are on campus. So the response to that has been positions like yours that are tremendously important and encouraging to see. But what kind of supports exist on the campus right here in our community?
Yeah, and I'll start by saying you're not alone in that shock. We often bring stats and numbers with us that are more specific to TRU, and it's consistently shocking for people. So you're definitely not alone in that.
Can you talk a little bit about that before you, sorry to interrupt you. Can you talk just a little bit about that before you move on? What do those stats look like right here in Kamloops and on our campus?
I do not have them quite memorized, but we're lucky enough that the Wellness Center. No, that's okay. We're getting better at collecting those kinds of numbers, though, in different surveys. So the Wellness Center at TRU has run a national college health assessment for a few years in a row, and it does ask questions about sexualized violence specifically. So then we use those to kind of extrapolate very rough numbers. We know statistics are always flawed anyway, but we've really found that giving people solid and specific numbers of sort of a range of what they could expect on our campus really it does a good job of demonstrating the impact on campus. And that's only for students too, right? So we don't want to forget about the fact that staff and faculty can experience violence. They can have histories of experiencing violence. And so my position on campus does offer services and supports for students, but also for staff and faculty. If they want to connect about something, we can give support there as well. So for students, it can look like maybe looking for academic accommodations if they're needing support to get through a semester or a course or something. It can look like emotional support, connections to counseling, KSAC, or counseling at TRU. It can look like safety planning for some folks on campus or in the community. We can do some accompaniment to hospital or RCMP, kind of depending on workload and time available for people. Let me just check my list and see if I missed anything. Oh, and then the other thing that we do in terms of offering support is we kind of support people. So if someone discloses to a faculty member or a staff member, they can come to us and say, I really don't know what to do with this right now. Can you help me out? Or if a friend gets disclosed to, they can come to us and say a similar thing, and we can help them to sort of support that person in the best way possible.
Megan, can you talk or expand a little bit about that safety plan piece? Because I imagine that's really important. You know, you think about this kind of an event happening on campus, and it's likely going to be with someone else who you would interact with or run into again on campus. And the traumatization of that and the fear and the way that it would affect your ability to carry out your education, not knowing when you might encounter that individual again and feeling so incredibly vulnerable. Can you talk a little bit about what a fair expectation about safety planning might look like? And I imagine that also transfers to the larger community. That same concern exists when it's off of campus, but on campus, what does that kind of look like?
It of course is very dependent on the student and the context. People have so many different kinds of experiences with violence. So we can help people set up or kind of articulate where their support networks are, who they can connect with, and sort of anticipate when they might be in spaces that they need additional support. If they're involved in a criminal process or a court process and there are no contact orders or anything like that, we can help implement those on campus if they're willing to share those with us. If someone's going through a reporting process through TRU, if they report it to the institution to respond to and investigate, then that safety planning would look a little bit differently too, and might include the respondent not being allowed in certain spaces. So it's really dependent, but we work with the person and what they need and where we can connect them to make sure that they feel as safe as possible within our limits as well.
Great. And great for people to know that they can expect and ask for that. Now I would like you to help me build something safe so that I am not vulnerable all over again. I think that's an important one to know as advocates coming along survivors, that we can also say, and how are you going to help them set up a safe environment that doesn't put them back into situations of re-traumatization? This is a question for everyone, but maybe we'll start with you, Jen, your response, and then you guys can kind of jump in. But often when someone discloses that they've been assaulted, there are questions or curiosities for the person who's receiving the disclosure. And I think that that's really natural. But how can we make sure to ask questions that are helpful and not just satisfying our own curiosities? And I think kind of the flip side to that, just practically, is that I think there's also a fear around, well, what if I don't ask enough? What if I seem like I'm too timid to really have the information that they need to share, or that kind of a thing? So how do we kind of walk that line around not just being curious and wanting to know for the sake of it, but actually asking helpful questions that serve that person that we're looking to support?
Mm-hmm. I think it kind of goes back to what Alex was saying about letting the survivor take the lead in the conversation, because a person might feel comfortable sharing a lot of the details about what happened. And again, I think we might talk a little bit about this later too, but whether or not that's safe for you to hear in that moment is something that you might have to navigate. But at that time, letting them talk and share what's comfortable for them. And if you are asking questions, I think just kind of taking a moment to think, is this a question that the answer is going to support me supporting this person? Or is this a question that either I just want the salacious details, or is this a question that might look like I don't believe the person? To go back to what Corey was saying earlier, if you're sort of saying, asking a bunch of questions about well, what happened? Are you sure? Did they really do that? Did they do this? That can really start to sound more like disbelief than like care. Mm-hmm. And so I think just recognizing that you don't really probably need to know much more than what the person is offering to be able to be with them and offer a supportive, listening ear and resources that they might need if you have those available. You probably don't need a whole bunch of details. So I would say really just check in to see if the questions you want to ask are going to foster a more supportive response. And if not, I think it's probably best that you don't ask.
Well said, Jen. Yeah, that's a bit of an unexpected answer for me that makes a lot of sense, right? We are holding vessels for the person at that point to invest the information in that's helpful, and it's not our job to mine for information. Tracy, did you have a hand up there?
Yeah, I just wanted to add another perspective. So I 100% agree, and exactly what you're saying. I say to the start volunteers, sort of stay in your own lane, for example. So just a cautionary tale that, and I love your guys' approach, because I really feel it's, and Rachel, correct me if I'm wrong, it's really a risk to the integrity of investigation if they start disclosing details of the assault to you, and now RCMP has to listen to the story, the statement from the victim, and then now there's another person has details, and if those details don't match, and she said one thing to you guys and one thing, again, Rachel, correct me if I'm wrong, but that is a risk. So I really appreciate you guys staying in your lane. Like, what do you need? Here's some options. Here's what to expect. And I also just back to my last question, I wanted to add that too, because I really like this community to understand this too. I really want you to know that at Royal Limit, we're creating an incredible environment, and there's that risk that survivors that come into merge that other people will notice them there, especially if there's a police officer with them, that they'll know what happened, and they just can't afford to risk that, the privacy and confidentiality. So we worked really hard with our department. We created a room called the Butterfly Room, and it's outside of the merge department, and so our survivors go straight to that from triage. And it's a gorgeous room that's done up with support from the Big Bear CYC. And so that's a really nicer place. They're not behind a curtain. They're in like a closed door room. There's a lot more privacy and confidentiality, and they can actually leave without going through the department. So I just want you guys to know, if you're speaking to and saying we really are doing our best efforts to ensure that confidentiality and privacy for them.
Yeah, excellent information for sure. Rachel, I'm sure you would have things to say about those ones too, but I'm going to redirect you just in the interest of time. But I'm wondering about, tech facilitated sexual violence is a really big issue right now. And again, speaking as the mother of 3 teenagers, it is a terrifying world to me that we don't know what's on the other side. And we can put all the safeguards in place possible, but the exposure risk is really, really scary out there, and for what that looks like. I'm curious about, maybe we back up and start with Jen and Megan. And again, we only have a couple minutes left. There's so many things I want to ask, but maybe we'll just spend a little bit of time here for Jen and Megan. Online safety is an increasing concerning issue when it comes to the virtual sexual harassment and exploitation. Can you tell us a bit about how that might look and how we might support people who have experienced that kind of violence? Because it's so different, right? Like, we used to think of sexual assault as, bodily harm or whatever we want to call it. There's a physical interaction, but the trauma experienced through a screen is kind of that same innate feeling. So how do we support someone in that kind of a scenario?
I think it's really important to normalize the fact that, like you said, it is a different way for violence to be enacted upon a person, but it is still violence, and it still hits the same way as other forms of violence. But there is this tendency, I think, to think that it is less because it's facilitated through a screen and you're in a separate physical space from the person. But that also comes with its own weird fear, because sometimes you don't even know who this person is, and so you don't know how vulnerable you are to them in the real world. Like, all of that can add so much to that fear and the trauma around it. And I think it's really such a tendency for people to already kind of undermine their own experiences, as we've been talking about, sort of feeling like, oh, this isn't that big of a deal. I think that can happen even more sometimes when these things happen online, and then people feel like, oh, what's wrong with me that I'm having such a big response, or I can't get over this thing. So I think really just driving home that idea to people that, like, that was violence that you experienced, and your response to it is normal, and it might take time to feel safe again. And that response is totally valid.
Yeah, and I think that's the key word there, right? Validating that for people, that whatever reaction you've had, whatever that violation has looked like to you, that's valid. And you have the right to have support for working through that and responding to that. And then, Rachel, what legal recourse is there then for people who have experienced tech facilitated sexual violence?
Yeah, so whether an offense happens like face to face or online, it's criminal offense. So same thing applies. Unfortunately, what I've been seeing a lot with online stuff is that it's super inappropriate, and it just like sadly just doesn't fall necessarily under a crime itself. So it doesn't like, and I hate always turning people away. And so I try to take like an extra few minutes to explain that, like, exactly that validation piece of like, it can be just as traumatizing, these things that people are subject to sometimes, with online things, but it doesn't necessarily fall under the threshold or the definition of a criminal offense. So when it is, though, it would be investigated the exact same way.
So when is it? What would be deemed that then, right? As we kind of look at those things, I realize it's complex and the criminal code is its own beast. But are there some things that like clearly fall within that parameter that are like, no, that is something that's worth looking at from a criminal perspective?
Yeah, I mean, and that's one thing that's why I always encourage people to report it, because I would hate for a survivor to be put on that fence of, oh, is this a crime? Is it not a crime? If they are unsure, that is not up to them. That's up to the police to investigate and have that knowledge. Like, I wouldn't want to put an extra piece of something on a survivor. And so if there's something we can do about it, perfect. Things that I can think of off the top of my head where like the criminal code has been adjusted in the past few years, is distribution of intimate photos without consent.
Right.
So that was like a really good step in the right direction, which can have a huge impact on people. So, whether it was distributed with consent in the first place and then later on shared without that person's consent, that is now a criminal offense. So in that sense, that's good. That we could address that now.
And it's so interesting because that can look so different. Like I think about that incident that just happened in Parliament, where there was someone who didn't realize that he was on camera and unclothed, and someone took a picture and shared that. Right. And I think so often that is trivialized. That's a ha-ha moment. That is not a ha-ha moment. That is someone's body that they live in every day that has now been without consent, given out publicly. And it's so nice to know that we are redefining what's okay.
Yeah. And even exactly that situation where of even like recording or taking photos, even if like maybe the act itself was consensual, but the recording of it is not,
right,
that is a very clear voyeurism offense. So that falls under that. So those things where people might not know, like the survivor, oh, I was having consensual sex, but then this happened, so don't know. If they're unsure, I know like a lot of people at KSAC have my number, so give me a call. I'm very free. Like, you can just bounce something off of me and we can decide what the best course of action is.
Okay. So basically, if you don't know, but it felt wrong, it is worth talking to someone about.
I think so. Yep.
Yeah. Megan?
I was just going to add quickly from a like campus policy perspective as well. We have included incidents and violence that happens online and in virtual spaces. So if it is connected to campus and people are wanting to report, then that could be a potential avenue that they could connect with our office about, and we could figure out if that was an option too.
That's great to know. I see people are dropping some helpful resources there in the chat as well that we can visit and look at after. And again, we're kind of out of time for the panel and the discussions, but there are two more that I want to get to. So I'm going to stretch it out a little. We have again given that 2:30 buffer where we can create some conversation, but I think there are two other kind of important ones to touch on. One is, what are the legal obligations around reporting disclosures of violence? I think that's really important. We worked for years at a summer camp. So obviously we were working for minors and we managed that camp. And we talked a lot to our staff about that, that there will be moments where a child will disclose something to you. These are your obligations and this is what's required of you by law. And it's important for us to know how we respond in that way, to responsibly respond without pushing that person into things that they're not ready for too. So kind of where are the boundaries with that? What is our obligation?
I could probably maybe speak to that in certain aspects. So certain organizations or agencies will have their own duty to report a disclosure. However, if you're citizen supporting a friend, for example, the average citizen has no legal obligation to do that. It's just certain agencies or organizations will. Even I know like through the hospital, they might have a duty to report that this occurred, but not any further details. And that's where the RCP would get involved, kind of thing, and determine what the survivor wants. But they've done their due diligence on reporting, and then that's up to us to follow up.
Mm-hmm. And Tracy, maybe you can answer a little bit what that looks like differently for minors. You know, as you look at child maltreatment and those areas that you specialize in, does that differ when we're talking about people who are underage?
So yeah, I mean, back to the hospital. So the policy we actually were just finishing developing for interior health is that duty to report, where it's as a healthcare provider, and that it really is primary to child protection, so MCFD. And so from that, it would go to RCMP. So we don't have a duty or right to report directly to RCMP. And if certainly if it's a survivor that has the capacity to understand, so for example, informed consent, then we actually would encourage them to call RCMP from the hospital. So adolescents and adults. And yeah, and the younger kids too, same thing, that most of the kids come in with a legal guardian or caregiver, and we encourage them to report themselves on behalf of, or again, we'll be calling child protection at that point. That's sort of how, when it comes through the hospital system. Certainly if there's a child or youth that comes in and there's a risk to their safety or well-being in that moment, we can directly call RCMP, but otherwise we go through child protection.
Right.
Does that answer the question?
Yeah, I think it definitely does. And then just as a final question here, and we had lots of other great ones. I'd like 7 hours to talk to you guys and glean your wisdom and experience. But just kind of as a wrap up, this was my own thing. If we only take one thing away, if there's one thing you could tell people who are responding to a sexual assault survivor who has disclosed to us and has been willing to make themselves that vulnerable to invest that to us, if there's only one thing that you could tell us, what would it be about what our response should look like to somebody who discloses to us? Corey, do you want to start that one?
Sure. I'm going to echo what I said earlier. I think it's very important to let people know that you're sorry that they experienced that and that you believe them. That's going to go so far.
Anyone else? Jen, your thoughts on that?
I think, yeah, like, don't overthink it. Just realize that this is a privilege, that this person trusts you enough to bring this to you. And that if you sort of listen more than you talk and kind of let them lead and just be there with them, that's probably like 90% of what they need in that moment. And then, you know, moving on from there can be a conversation that you have. But just stay calm, keep breathing.
Humble approach. Megan.
I was thinking along very similar lines. We often tell people that if someone is disclosing to you, then they've chosen to do that for a reason. You've shown them that you're a safe person to tell. So kind of reminding yourself of that, and you don't need to be an expert in anything. Google can be your best friend to find resources. That's okay. So yeah, I think just kind of what everyone has said, and recognizing that this person made a conscious and deliberate choice to tell you. So you're doing something right already.
Mm-hmm. Tracy.
Again, echoing everything everybody's saying, particularly around that fact that you create that safety net for them to come, and really just to see as a privilege and an honor. But I also, on the flip side, I'm always asking people to check in with themselves as well. So if it's a trigger for them or a background, so that they can sort of address it, thank them for coming, and I'm going to do whatever I can to get you on the right track, and sort of politely sort of remove yourself, because I feel that's not helpful for our support person, but also ultimately for the survivor. So just honoring yourselves in that as well.
Yeah, Tracy, that's a good point, to remember that you are also a person responding to this information, and that it's okay that you are reacting as well and feeling things, and to take care of yourself in that moment. And Rachel, anything to add there? I think especially through that RCMP lens, what do you wish people would know before they walk through your doors that would I mean, maybe this is improper language, but improve their experience or protect them in better ways? What would be helpful to know?
Or like always looking to improve. And Tracy, you kind of took the words out of my mouth of like, I feel privileged when someone comes in and is willing to just talk to like a perfect stranger and tell me what happened. So that's something that I'm really working with the entire the detachment, really working on our own language that we use, and really explaining to victims like, why am I asking this? Where it might come off as maybe like accusatory or whatnot, or not believing them, but I'm asking this for a specific reason. This is why, trying to give them that information, so that it's not coming from a nefarious or negative standpoint. It's really to try and help that person, and knowing how the whole process goes. This is kind of why I'm addressing that, and so that's how I feel when someone comes forward and I try to make myself available as much as possible for victims who want to like specifically speak to a female officer as well, and things like that. So, and feedback for us is always great too. Even after the fact, if we hear things like, I've heard things through CASAC and I've heard things through survivors as well. That's always something that I can relay back to members to help them keep getting better as well.
Great. Cannot thank you enough for your time and for your honest answers, and also just for the work that you do. I critically needed work to support people and people in the most vulnerable moments of their lives. Often we appreciate you, and you're willing to invest in people in this way. And like Jen kind of said at the beginning, and Croy did too, it matters. And we don't have the right just to step away and say, this makes me uncomfortable, or, I feel scared in this moment. People need people. And if we can bring some healing in this moment, that it's important that we do that and do it well. And Alex, maybe I'll just turn it to you too, and see if you have anything to add to that, because you do see people at their most vulnerable all the time, and don't leave it there. Then you walk with them throughout those weeks and months and years as they seek to heal from this and figure out how to kind of incorporate it into their life that was before and their life that is now. What would you kind of like people to know about the work of CASAC that we might not know, and might be really influential in these moments to help people receive healing more quickly?
So I think, for me, and I share this with volunteers because folks are nervous to go into their first crisis call, or to, have
understandably.
Yeah, it's intimidating, but 99% of this work is just showing up. There's information that you're never going to learn it all. You're never going to have all of the information. You're never going to be able to know exactly how to respond or the answer to every question. But showing up for a survivor in a moment of need is the single most important thing you can do. So whether that's showing up in the hospital with them as a crisis response worker, or picking up the phone when your friend calls, or just sitting with your sister when she tells you about her story, it's just showing up and being authentically yourself, and honoring that person has trusted you enough to share this sacred piece of their heart with you. It's an honor. It's hard, and it's sad, but the reality is this stuff is happening whether people are telling us their stories or not. And this is kind of my response as to why I do this work. It's not me not paying attention to it doesn't make it happen any less. And so we can only do what's within our scope, and for what I do might look different than what lots of folks on the call might do, but really just show up for survivors, believe them, and let them know that you care and support them. And that is what CASAC is designed to do as well, in some different ways, and perhaps more formalized than in the ways that you might support a survivor in your own life. But that's ultimately what we're here to do, is to just show up for people, in a hospital setting, in a court setting, in a counseling setting.
Beautiful. And Alex, if somebody wants to volunteer, my honest hope is that somebody in this setting who's joined us today says, I feel that calling. I feel that pull in my heart. I feel that conviction of compassion for others. How do I do that? How do I start showing up? What does it look like to get involved and to volunteer for one of those programs?
Yeah, just get in touch with the office. I can put my email in the chat, and I can put our office phone number in the chat, and get in touch. We're happy to have folks join our team. We're always looking for people.
Awesome. I didn't see a ton. I saw a lot of good information kind of flash up.
There's a few questions.
Are there questions? Okay, let's
Yeah.
take a look at those.
Yeah, so I think this one would be for Rachel. What if people send sexually explicit photos without your consent? So if someone sends me a photo that's sexually explicit and I did not consent to viewing it, is that criminal?
That in itself, like one photo is one of those examples where that's not actually wouldn't really fall under a category of an offense. Certain things that I've looked at in regards to that is like harassment, which can also be online. So if there's like tons of messaging, or if there's like a specific age group or a power dynamic, it can also fall under a certain category of like a sexual exploitation or indecent exposure and whatnot. So that one's a little bit more case specific. It's not a clear black and white, but that's another one of those. If it's reported, we might be able to look into it. There's also certain aspects surrounding how that came about. Like if you know the person who sent it to you, or if it's one of those kind of, we've talked about like those bots that are just really a nuisance, like harassing people online. That's a little bit harder to kind of dig down. Unfortunately, our criminal system doesn't keep up with technology very well. So that's one of those things where it's not a hard yes or no, but can definitely be looked into.
And I would just add to that we, like at CASAC, we are prepared to acknowledge things that might fall outside of the criminal justice system, right? Like Rachel said, the criminal code has not kept up to the creative exploitations of perpetrators, unfortunately. So whether or not it meets a criminal threshold, for survivors, don't let that take away from the trauma and the validity of that experience. It doesn't, in terms of your own healing, it doesn't really matter whether or not it was criminal. It impacted you, and there are supports available for that, regardless of what the law says about it.
I'm so glad you said that, Alex. And I think the same thing, like for the purposes of this conversation, it's so important for us to tuck that information away, to talk to those who might disclose to us, to say like, there is no line of valid and invalid, that the criminal code does not define what is valid. And so there is nothing too small worth talking to somebody about who's seen the broad spectrum of these experiences.
Yeah.
Next question in here. In cases of sexual assault, will the RCMP make it a priority to send female officers to speak to female survivors? So I guess kind of another piece of that question is there an option to choose to say, I am more comfortable speaking with, or I can't speak to a male officer in this moment? Is that, or is that already prioritized?
So in regards to like when someone reports it, it will just be dispatched to kind of how we're working right now is that I obviously can't take all the files. I do have oversight on everything sexual related, but the reality is that it might get dispatched to a frontline male officer. If that is like a really big concern, the survivor can definitely request to speak to a female officer, and that will be accommodated as much as possible. Now, obviously, we can't always accommodate that, but in a place like Kamloops, where there's a whole bunch of female officers, and unless this happened right now and it's pressing and we need to get the information right now, I personally don't see why that would be an issue, even if it just needs to be rescheduled for a statement the next day or something like that. I wouldn't see an issue with that whatsoever.
Okay. And our next question, and a few of you might have input on this one. It's a specific circumstance, but I think that one that really could apply to anyone. What do you do in a situation where a child is disclosed, but their abuser has passed away? So maybe it's a trauma that they experienced in their childhood, but that perpetrator is no longer here. What happens then? What does that look like?
I can throw in my.
I thought you might.
Yeah. Interpretation of duty to report. There is always a line of judgment, like personal subjective judgment in that. It would depend on the circumstances. Ultimately, the child protection duty to report comes when there is risk to a child. So if a child is still a minor and is potentially still at risk, despite the fact that their abuser has passed away, then that would, you would still need to report that, because if a child is still at risk.
What does it mean to still be at risk although the perpetrator has passed away?
I mean, if someone's in a family home and if a parent has failed to protect their child from violence in the home, then that can be a child protection concern, just because of the fact that that parent has not acted in a protective way. They were unable or unwilling to keep their child safe. If that situation is there's potential for that to happen again. If there's concerns around supervision or negligence potentially, that could be a concern. If it was 30 years ago and that child is now an adult, that's less of a that's not still a child protection concern, and so there's less of a legal obligation to report that. But again, it's going to depend very much on the specific circumstances of the situation. And when I'm considering whether or not to report something, I always just base that decision on, do I feel like this child is at risk of being harmed?
Mm-hmm. So the most obvious answer is talk to someone else. Escalate this to those who would be able to answer the questions considering the circumstances. So that was
and when in doubt, it doesn't hurt to report. Child protection workers aren't going to go and remove a child from their home without doing a fairly thorough investigation. There's lots of pieces to that, but there's you don't have to worry that if I make this call, that child is going to go be picked up that afternoon and never see their family again. That's not the way the system works. And so if you are doubting yourself, it's okay to make that report.
And no matter what, supports need to be built in for that child, right? So that information still can't just live where it was disclosed. I mean, that support network needs to be established. What are local supports for victims of domestic sexual assault who aren't currently looking to leave? So what does it look like? You're not ready, at that point to leave that situation, to walk away. People's lives are complex and their considerations are many. But what does it look like? What are local supports for victims of domestic sexual assault who aren't currently looking to leave?
I mean, I guess this might be me again.
Well, we're in your lane, so I think that's okay.
We are happy to support folks that are remaining in a relationship. Every person is the expert on their own lives, and they get to decide what to do with that life. And they are also the most adept at keeping themselves safe. So services available, you can access counseling, you can access safety planning. So if you know that this is a risk for you of experiencing some sexual violence in your domestic relationship, what kind of safety planning can we do to try and keep you as safe as possible? And I think it's important for folks that are living in violent relationships to know, certainly at CASAC, and I know like with the Women's Shelter and other local organizations as well, there's no judgment on what your choice is around staying or leaving, reporting or not reporting. You, again, get to decide that, and we're happy to support you, and we feel honored to support you regardless of what decision you're making there.
Jen, I'm kind of curious about that one too, just from your perspective, what it looks like to support someone as a friend in that kind of a situation. What does it look like not to be judgmental of that and to still come alongside?
Mm-hmm. I think that especially when it's in a friendship relationship or a family member or someone that you love, it can be really frustrating, honestly, to see somebody in a situation where you feel like you know what you would do if you're in the situation, which of course you never can. But sometimes we can think those things, or we think that we know what a really good choice for this person would be. Mm-hmm. But like Alex said, just continuing to leave those decisions to that person because they know their life. You might have all kinds of ideas of what you do in their situation, but you don't actually know their situation on the inside like they do. So sometimes you might want to have a moment of, feeling a bit frustrated about your friend or your loved one being in that situation, because you care for them and you want them, to be possibly safer. But that's probably not something to bring to them. Like when you're with them, all you need to do is be supporting them and letting them know that you are going to be there to just continue to be by their side, no matter the choices that they make, because ostracizing people in those situations does not make them safer. It only increases their isolation, but also, like honoring the fact that, like you said before too, you're still a human being, and that's going to have an effect on you to see a loved one in that position. So make sure that you're taking care of yourself as well.
Yeah, Tracy, I was just wondering whether you might have something to add. So we'll take Tracy's contribution here, and then I think we'll wrap up because we're getting close to the line. But yes, Tracy, we'd love to hear.
Yeah, thank you. I just also have to advocate absolutely supporting anybody involved in domestic violence, but just from a child protection standpoint, just so anybody that is receiving the information from a friend or a colleague or whatever that might look like, just always be, for you to be aware to if there are children in the home, children witnessing violence is a completely life-altering change for children. But also, if they can often get caught in the crossfire of a domestic, no matter how much we want to protect, that is a thing. So just remembering that you might, it's not just sort of the survivor that's sort of in that thing. There could be children, and so you have a duty to respond to that as well, which can be very challenging. But if you have direct information that a child got hurt in that, or they're witnessing a lot of violence, I would encourage you also to sort of weigh that out and speak with child protection or speak to an expert in this area to get some guidance.
I'm so glad you added that. And yeah,
I just wanted to echo as well that similarly to CASAC and everywhere else, the TRU supports are also available to people experiencing domestic violence who may not be willing to leave, and all of that. All of the services that I mentioned earlier are offered to those folks as well.
Yeah, it's such a good, like, you make your choices. Our ability or willingness, maybe is a better word, to support you is not contingent on what your life looks like or the choices that you make. You are deserving of support regardless. So, I mean, at the end of the day, I wish none of you had jobs. I wish that there was no need to have this conversation. I think about the work that Tracy does and the fact that it's necessary, and I wish there was no job description for that because it wasn't a thing. But the reality is, like Alex said, this is the broken world that we live in, but we get to choose to be people who respond and who are not scared of the hurting, but instead come alongside. So thank you for being people who make that choice and also who choose to educate the community. You are making a difference in this world every single day, and you made a difference here today as well. So thank you for the choices that you make every single day to stand on this ground firmly and to support and believe survivors and build in real resources that they can use to begin to heal their lives and walk forward from this kind of trauma. Alex, thank you for setting this up, for having this thought and for having this idea and for stepping into this space every single day on behalf of our community. United Way is so proud to support CASAC. We're so proud to support CASAC and the work of you all. So thanks for what you continue to do. Alex, do you want to add anything before we close out today's session?
No, I just want to echo what Katie said and put my hands up to all the panelists who have joined us and shared, their perspectives and information, and to all of the participants that have come to listen. This is how we make social change. This is how we support survivors in Kamloops and beyond. So thank you for being a part of this work and taking a step. And the crisis line number is in the chat. So if anyone needs that, scroll back and find that. And you can find more information on CASAC's website as well. So whether you're needing support for yourself or looking for resources or trying to get involved, you'll find that information there.
Wonderful. Thanks, everyone. Thanks again to the panelists and for all of you who took time out of your day on a Friday to learn a little bit more so that we can love people